Welcome to the Lamp and Light Fellowship of Nurses channel, and I'm your host, Nurse Fran. And the goal over here is to equip nurses and change lives. And one of the ways I do that is by tutoring nursing students. So if you are in nursing school and if you need help with pharmacology, med surge, or fundamentals, I do offer one-on-one tutoring sessions, and you can book your session at www.lampandlightfellowshipofnurses/services. But for those of you who are in nursing school, one of the things that you're going to come across is hypokalemia. And not even just in nursing school, but if you are a nurse or if you are in the medical community, hypokalemia is going to be something that is very common because we have a lot of people who are aging. We have, an elderly population which is growing. And with that elderly population comes, certain diseases such as CHF and with the CHF, they have to take diuretics. So this can affect their potassium level. So a normal potassium level is anything between 3.5 to 5 milliequivalents per liter or millimoles per liter. So anything less than 3.5 is termed hypokalemia, and anything greater than 5 is considered hyperkalemia. So what we're going to be talking about today is hypokalemia, which is a serum concentration of potassium that is less than 3.5. So anything, again, that's less than 3.5, we consider that hypokalemia. And the way that it is diagnosed is through either a CMP, which is a complete metabolic panel, or a BMP, which is a basic metabolic panel. So sometimes, depending on that potassium level, the patient may not have any type of symptoms. If it's relatively mild, they might not know anything about the low potassium at all. But it's not until they start presenting with symptoms that they come into the doctor. And sometimes these symptoms can be something such as like fatigue, or if it's more severe, it could be something like altered mental status. So when the patient comes in, of course, again, you're going to check their potassium level. And one thing that you're also going to do is get a good history on that patient. So as a nurse, your job is to get an assessment. And anytime you get an assessment is the collecting of information about a patient, whether it's through like your physical exam or whether it's asking the patient questions or even asking the family members questions. So you're going to ask them about their past medical history. You're going to ask them about what kind of medications do they take. Do you take diuretics? Are you active in sports? Do you sweat a lot? Or have you been eating much? Because if patients are NPO, sometimes if patients have been fasting, because now people like to fast, they have intermittent fasting, but sometimes people like to do prolonged fasting, which is for an extended amount of time, right? And with that extended fasting, they're at an increased risk of developing hypokalemia. So potassium is pretty much found in all of the foods that we eat. So low potassium, especially in the United States, is not caused by dietary insufficiency. So again, if a patient presents with a potassium level that is less than 3.5, you're going to think about hypokalemia. And hypokalemia, depending on the potassium level, it can be life-threatening because potassium, it can affect every major system in the body. So if it gets too low, the patient is going to present with certain signs and symptoms. So when your potassium is too low, it can affect, again, every major organ system of your body. So when it is affected because it's too low, that means that some of the tissues or some of the organs in your body they've been desensitized, so to speak. So they're less excitable. And most of the things that are affected are going to be like your nervous system and also musculoskeletal system. So as a nurse, you're going to make sure that you get a good history and physical exam on the patient. You're going to make sure that you're asking the patient questions, right? So that is what you want to do. And you might find out that the patient, their potassium may be low because they have had some vomiting. They may have went to, a local restaurant. They did the all you could eat, the buffet, and they were not planning on having diarrhea. They were not planning on food poisoning. So they got home and they were sick and they were vomiting. They had diarrhea, and because of that, their potassium is low. If they have high blood pressure, especially with African Americans, one of the first medications that is first line medications used to treat high blood pressure is thiazide diuretics. That's something like chlorthalidone or hydrochlorothiazide. And even though hydrochlorothiazide is a weaker diuretic than chlorthalidone, it still has the potential to cause hypokalemia. So, in other words, it does not spare the potassium. Also, besides vomiting and diarrhea, there's also use of corticosteroids. So people who take steroids are at an increased risk of developing hypokalemia. And also patients who are on DIG-like medications. So even we've talked about a patient being NPO, but what if a patient has a drain that's draining a wound? So if they have wounds that has a high output, especially if you have a patient who has, let's say they've had a colon resection, or they have a history of colon cancer and they had colon resection because of that, they're going to be at an increased risk of developing hypokalemia. So, as the patient's nurse, you want to examine your patient because again, that's one of the ways that you're gathering information for your assessment so that you can come up with your nursing diagnosis, and also based on that you also want to develop your implement. What are you going to enter? What are your nursing interventions going to be? It's going to be based on your diagnosis and your assessment findings. So in a patient with hypokalemia, because as we said, a low potassium can affect every major system in the body. And again, sometimes if the potassium is low, the patient may be asymptomatic. But if the loss is severe enough, they are going to have some type of symptoms. And in the cardiovascular symptoms, the patient may have a weak 30 pulse, or on an EKG, you may see U waves or inverted T waves. Also, the heart rate they can have tachycardia, and the heart rate can actually fluctuate. It can be low and it can be high. So you have range in between. Musculoskeletal system, someone with hypokalemia, they can have muscle fatigue or exercise intolerance. And not only exercise intolerance, also with the grips of the hands. They're not going to have strong grips. And also, as far as the neurovascular is concerned, they're going to be hyporeflexic. So when you get out your tool that you use to test their reflexes, you're going to find out that their reflexes are, they're not normal. So in other words, they are hyporeflexic. And sometimes patients with low potassium, if the loss is severe enough, that patient is going to present with some altered mental status because, again, low potassium, it can affect every major system of the body. And it like as far as the impulses are concerned, it is going to, what am I trying to say? It's going to be weaker, right? Because less excitable is what I was trying to say. It's going to be less excitable. They also have some intestinal changes because when potassium is low, it kind of slows things down. So in the GI system, you may see some nausea or vomiting, but when you do your nursing assessment on exam, the patient may actually have some hypoactive bowel sounds. They're going to have some peristalsis. So you definitely want to make sure that you listen in all 4 quadrants for bowel sounds on the patient. And we definitely cannot overlook respiratory changes. If a patient has severe, let's even back it up. If they have hypokalemia, hypokalemia can affect the respiratory status, right? So you want to make sure as a nurse that you are doing frequent respiratory exams on your patient. And you don't have to go and put a stethoscope on them every 30 minutes, but you definitely, when you go into the room, you want to look at the rise and the fall of the chest. You want to look and see if the patient is using any type of accessory muscles when they breathe. You want to look at the patient's color because you're looking for oxygenation. You want to look at their O2 sats, right? Because when the potassium is low, it can cause respiratory compromise. If it is severe, and severe hypokalemia is a potassium level less than 2.5, they're at an increased risk of going, respiratory distress or respiratory failure. So you definitely want to do a respiratory assessment on this patient every hour. When you go into the room and you do your hourly exams, you want to make sure you are looking at the patient. You want to make sure you are assessing the patient. And also with assessment, it comes asking questions. Do not be afraid to ask questions. If the patient is asleep, don't be afraid to wake that patient up because you don't want them to, sometimes people don't want to wake the patient up because they may be afraid that the patient is going to verbalize a complaint. Wake the patient up. Ask them if they're doing okay. Ask them if they need anything. You want to make sure that you are laying eyes on that person. You want to make sure that the patient is safe because patient safety is your number one goal. So you want to make sure that you are being a safe nurse by making sure that your patients are safe. So make sure that you're, again, assessing your patient. Make sure you're answering questions, asking questions. And indeed, this is like what you want to do. So that is your assessment. And your interventions, of course, is going to be based on what you find. So for somebody whose potassium may not be very low and they were asymptomatic, you can stress to them the importance of diet. And of course, diet is going to take a while for, the potassium level to become normal again. But you definitely want to educate them on food sources that are high in potassium. Potassium is found in most meats. It's also found in citrus fruits. It's found in apricots. It's found in avocados. It's found in like oranges. It is found in different foods, but less so in like breads. And it's also found in like lentils and peas and legumes, things of that nature. So you want to tell them to make sure that they increase their dietary intake of potassium. And also you want to give them PO potassium by mouth or enteral potassium. So when they take that PO potassium, you want to make sure that you tell them, do not take PO potassium on an empty stomach because it can cause severe GI distress. It can cause nausea and it can cause vomiting. So tell them to take their PO potassium with food or like immediately after their meal, but it definitely does not need to be on an empty stomach. It should always be taken really around mealtime. And for those whose potassium, they present, and let's say their potassium, and they present and they're symptomatic, the physician may order IV potassium. So as a nurse, what you should know about IV potassium is that it can cause phlebitis, and also it can be very caustic, which means that it can like burn. So you do definitely want to be aware of that. And when you give potassium, it should always be verified with another nurse. If the patient, has some complaints, if a patient has a complaint, y'all, as a nurse, your number one thing is always to assess. Assess, assess, assess. So if someone tells you, look, I'm burning, you want to assess the situation. If they are burning, sometimes you can slow the rate down, but let's say you slow down the potassium and they're still burning. Of course, you may need to stop that potassium. And also, when they complain of burning, you want to make sure that there is no phlebitis, no swelling of the veins. So you definitely want to do a visual check. Put your eyes on the patient. If a patient comes to you and they verbalize a complaint, your first thing that you should do is assess the patient. Assess, assess, assess. The patient always, you assess the patient before you assess equipment. You always assess the patient. So they have a complaint, assess. And also, if your potassium is never given IM, it's never given sub-Q because it can cause too much tissue damage. So that's why it's given IV, and it should always be prepared by a pharmacist if it's IV medication. And also, as a drug alert of potassium, a dilution no greater than 1 milliequivalent of potassium to 10 mL of solution is recommended for IV administration. And the maximum recommended rate is 5 to 10 milliequivalents per hour, and it should never exceed 20 milliequivalents per hour. So you've given the patient their potassium, and you want to make sure, because now you've assessed, you have your diagnoses, you've interacted with, you've put in your interventions, right? You've implemented your interventions. Now you want to evaluate if the patient is responding to the therapy. So one way that, of course, that you can evaluate is going to be looking at their potassium level on the BMP or the CMP, or the physician may just order a potassium level. And that potassium level should increase. So if their symptom improve, that means that they are responding to the potassium. If they came in with, let's say they came in with altered mental status and they were confused and they were disoriented, they didn't know the time of the day, or they didn't know the year, they didn't know the event situation, they didn't know anything. But as their potassium was repleted, and you do a mental exam or mental status check on the patient, you see that they become more oriented. They're oriented to their surroundings. They're awake, alert, and oriented times 4, right? Where at first it may have been only 1, or it might not have been 0, right? So the level of orientation is improving, means that they are responding to the treatment. Their pulse, you're able to feel a pulse. Their pulse is no longer weak. Their pulse is no longer thready, right? You're able to feel a pulse, and it's a normal pulse, +2. That means that they are responding to the therapy. Their respirations are normal. They're not having any type of labored respirations. Their O2 set is normal. And that's on room air. That means that they are responding to therapy. They are no longer fatigued. Their energy level is increasing. That means they are responding to therapy. Their bowel sounds sound better. That means that they are responding, y'all, to therapy. But you got to keep in mind also, and what I did forget to tell you, is that a patient who has a low potassium, this patient most definitely is going to be an increased fall risk, especially because you got to look at it. They have all of this stuff going on, right? And altered mental status, they're weak, they can't tolerate exercise, generalized fatigue. You want to make sure that you have this patient on fall precautions. So again, you have assessed the patient and you see that they are responding to therapy, and that's a good thing. So we have talked about hypokalemia, and so to back it up, a normal potassium level is 3.5 to 5. Anything that is less than 3.5 is considered hypokalemia. A patient with hypokalemia may be asymptomatic, but depending on the potassium level, they may present with symptoms. Hypokalemia can be life-threatening because it affects every system. It can affect every system of the body. Low serum potassium levels reduce the excitability of cells. People who are on like diuretics and corticosteroids, people who have been NPO, people who have been had nausea, vomiting, diarrhea, they are more likely to present with hypokalemia because of an actual potassium deficit. You always want to assess the patient from head to toe when they present with hypokalemia. You should be assessing a patient from head to toe anyway, especially if this is your first time seeing a patient. Every time a patient comes in, you should always do a head to toe assessment. Treatment depends on the level of potassium loss. If it's not so severe, they can be given PO, potassium supplements, and you want to educate them, you know, when they should take the medication and not to take it on an empty stomach. You also want to educate them on foods that are high in potassium. And if it's coarse, if it's too low and they have to get treatment, you want to give IV potassium. Make sure you're verifying it with another nurse. And if the patient presents with problems, you always want to, or complaints, always assess the patient, right? And if the potassium is less than 2.5, that means the patient has severe hypokalemia and they are at an increased risk of death due to the possibility of respiratory failure, respiratory distress, right? So keep your eyes on that patient. So I have a question, and this is the question. Okay, so let's say you are the nurse and you are caring for a Bobby, who is a 65-year-old female who has a past medical history of hypertensive heart disease with heart failure, COPD, and hyperlipidemia. She was admitted to the hospital because her lab work showed that she had a serum potassium level of 2.6. What expected exam findings, or what are the anticipated exam findings for this patient? A, and I want you to select all apply. A is weak in 30 pulses. B, hyperreflexia. C is shallow respirations. D is hypoactive bowel sounds. And E is altered mental status. So I'm going to let y'all think on that, and I'm going to give y'all the answer. Okay. All right, y'all. So Bobby, you can expect that she would have these exam findings. She's going to have weak and 30 pulses, right? That's expected. Hyperreflexia is not expected. Hyporeflexia is, but not hyper. You should expect shallow respirations. You should also expect hypoactive bowel sounds. And you should also expect altered mental status. So the correct answer is A, C, D, and E. And since we're on Bobby, I'm going to throw an extra question in there. Have y'all thinking on this. So you have Bobby, right? And she has that potassium of 2.6 milliequivalents per liter, right? And she's taking medications at home. If you are her nurse and the doctor orders certain medications, when you see this order, which order should you question, right? Spironolactone, 25 milligrams per day. Carvedilol, 6.25 milligrams BID. Lisinopril, 40 milligrams a day. Or digoxin, 0.125 milligrams every day. So again, this is the same patient, Bobby, the 65-year-old female with a hypertensive heart disease with heart failure, COPD, and hyperlipidemia. Potassium of 2.6. The doctor orders certain medications, the medications I just called out. And if you see this order, you see these medications, which medication would you question? Is it the spironolactone, 25 milligrams a day? Carvedilol, 6.25 milligrams BID? Lisinopril, 40 milligrams a day? Or digoxin, 0.125 milligrams per day? Okay, I'm going to let y'all think on that. Okay, the correct answer, y'all, is digoxin. And the reason why is you want to question digoxin is because digoxin can actually cause cause ditch toxicity in patients with hypokalemia, and it can actually worsen the hypokalemia. So that was the extra question or the bonus question for the day. So this was the presentation for today, and I plan on being able to edit some of these videos, but right now I'm kind of primitive, so this is what I'm working with. But if the presentation or if this has helped you in any type of way, please feel free to share it with some of your nursing friends who are in nursing school. If you have not subscribed to the channel, please subscribe to the channel. And if you are new or if you just want to leave a message and interact, please feel free to do so in the comments section. And I pray that y'all will have a blessed week. And also, I pray the nursing school will be prosperous for y'all. And I just pray that you get everything that you need out of nursing school. And I'm praying again that y'all will be successful so that y'all can become the nurses that you are aspiring to be. And I pray y'all have a blessed weekend. Bye.